In the physical therapy world, a lot of us do manual muscle tests to identify potential strength imbalances. What I have found to be a problem in the profession is that we like to label things as someone having a strength deficit or a muscle imbalance. And then we go to the treatment and just strengthen what's weak. But when we do that, we neglect one key area. What is the starting position of that person in front of you? Where is their center of mass biased towards? Because if I asked you to rethink that question, and if I said, you're dealing with someone that has an anterior center of mass, an anterior pelvic tilt, internally rotated, what do you expect the hamstrings to be? Weak or strong? And an anterior pelvic tilt, we would expect them to be weak because they are eccentrically oriented as the pelvis is tipped forward. Conversely, we would expect the quads and hip flexors to be strong. Why? The center of mass is leveraging the muscles to be strong or disleveraging the muscles to be weak. So if you understood that concept, then why, when someone comes in, are we just strengthening what's weak and neglecting their overall position, posture, center of mass? So I think a better way of using a manual muscle test is to start to confirm, are they in an anterior pelvic tilt where the center of mass is tipped forward, or are they in more of a posterior orientation where the pelvis is tipped back? Once we understand that, then we can start to understand, is this expected? Do I expect strength deficits based on their position? Then when it comes to the treatment, we're not just strengthening what's weak. We're first trying to get them in a different position. For example, if we have someone that is in an anterior pelvic tilt, instead of just trying to strengthen the hamstrings in this position, we need to first get them to learn how to orient from a more of a neutral position. The person that learns how to get strong here is ultimately going to most likely have more dysfunction. They're getting stronger in their dysfunctional pattern. They're not changing their center of mass, and they're telling their hamstrings to work. A lot of times it really leads to short-term results, and it's hard to get the long-term result, but ultimately we are strengthening a dysfunctional pattern. So I like to think of the muscle imbalances as something that's either expected or not expected. Anterior pelvic tilt, expected weak posterior chain. Posterior pelvic tilt, expected strong posterior chain. From there, we at least know where we're starting. What's the starting point? So I challenge you to use this framework in the clinic and use it during your assessments and your manual muscle tests. And I think what you'll find is that your patients should get better results. It's just taking that one step that we're already aware of, but for some reason tend to forget when it comes to assessments in clinics. And that's just a center of mass neutral position. Then once we've really learned how to teach the patient that, and they can control that, we should strengthen the heck out of them. But we're doing so in a much better position. So give it a shot. Let me know if you have any questions in the comments below. I'd be more than happy to answer. And I'll see you guys on the next video.